diabetes drugs can alter intestinal bacteria. Recent studies show that composition and function of intestinal bacteria are linked to various health conditions, like diabetes and obesity. More than 100 trillion bacteria are living and hiding in our intestines. They are called the gut microbiota. It is difficult to grow gut microbiota using traditional methods, because they do not tolerate atmospheric oxygen. Within the past few years, new research based on gene technology and advanced bioinformatics has made it possible to analyze the composition and function of intestinal bacteria from their DNA. These gut bacteria produce many different types of substances that affect our physiology and health in numerous ways. Dysbiosis is the changes in the composition and function of these complex intestinal bacterial communities inside the gut. The potential effects of drugs on the patient's intestinal bacteria and the microbial imbalance occurring inside the gut are also included. Both disease and its drug treatment can alter the intestinal microbial balance, so it is difficult to determine which dysbiosis is associated with the diseases and what changes in intestinal bacteria are associated with its treatment. Recently, European and Chinese researchers in the EU-funded Meta-HIT consortium have studied the intestinal bacterial communities. The study included a total of 784 Danish, Swedish and Chinese patients with type 2 diabetes as well as from healthy individuals. The purpose of the study was to differentiate the changes in gut microbiota associated with disease from that of intake of medication. The findings have been published in the international journal Nature on the 2nd of December 2015. Professor Olaf Borby Pedersen from the Novo Nordisk Foundation Center for Basic Metabolic Research at the University of Copenhagen is the senior author of the study. The study shows that intestinal bacteria change their composition and function when diabetic patients are treated with the drug, metformin. Metformin is the most frequently used drug for the treatment of diabetes. Metformin causes favorable changes in the gut microbiota in patients with type 2 diabetes. Metformin boosts the capability of the bacteria to produce certain types of short-chain fatty acids, such as butyric acid and propionic acid. These fatty acids can reduce blood glucose levels in different ways. The current view on pathogenesis of type 2 diabetes is believed to be the lack of certain combinations of fatty acid-producing intestinal bacterial species. Metformin is known to produce bloating and increased flatulence, because these patients have more coliform bacteria in their intestines. Thanks for watching. Please click the link in description for more information.